Thank you for joining me today. In this video, we are going to go over psychiatric differential diagnosis, and we are going to learn primary psychiatric disorders, medical disorders presenting with psychiatric symptoms, substance-induced disorders, medication-induced psychiatric conditions, neurocognitive disorders, cultural variation in behavior and emotional expression. We are going to apply a medical differential diagnosis framework to a psychiatric presentation. We are going to differentiate psychiatric from medical illness. We are going to integrate laboratory testing with a psychiatric assessment using a psychiatric diagnosis DSM-5 treatment diagnosis. We are going to apply a clinical reasoning. So fundamental of a psychiatric differential diagnosis. What is the diagnosis? Differential diagnosis. Differential diagnosis is the process of identifying the possible causes of the patient's symptoms and determine which diagnosis best explains the symptoms and clinical picture. The clinician asks what condition could explain the presentation and what evidence support the exclusion of each other. You want to define the symptoms cluster. You want to start mood symptoms. You want to explain if the person, what kind of mood they are feeling. Are they depressed? Are they sad, having sadness? Are they irritable? Are they hallucinating? You want to start with the symptoms. If they are having an elevated mood, if they have, then after that, you want to list the possible diagnosis based on the symptoms that you assessed. You want to see if they have, because if they are having a sadness, if they are having a withdrawal, you want to list the possible differential diagnosis such as major depression, bipolar disorder, substance mood disorder, thyroiditis disorder, anxiety. If they have any anxiety symptoms, you want to, for example, assist if they are having a worries, panic. You first assist the symptoms and then you decide which diagnosis fits that scenario. If the person tell you that they are worried, they are panicked, they are restless, they have any somatic tension, possible diagnosis will be a general anxiety disorder, panic disorder, hyperthyroid disorder. Is maybe they are using stimulants. If they have any psychosis symptoms and they are hallucinating, having a delusion, if they are having a disorganized thoughts and behavior, then the possible differential diagnosis will be psychosis, schizophrenia, bipolar manic with psychosis, substance-induced psychosis, delirium. Delirium is a medical emergency, so you want to rule out if this is delirium or if it's schizophrenia or bipolar. You want to also assess if they are showing or if they are having a cognitive symptoms such as memory impairment, confusion, poor attention. The possible diagnosis will be dementia. You want to list those possible diagnoses: dementia, delirium, depression, medication effect. Those can affect the cognition. And then later on, you want to rule out. Step 2 will be determine the time course, how long the patient have these symptoms. Time is one of the most powerful diagnosis tools. You want to ask the onset. You want to know the onset of the symptoms. Is this sudden? Is this consistent? You want to consider if they are having a delirium, if they are having a substance-induced intoxication, if they are having a stroke, if they are having a seizure. Those are emergency, and that is the onset, sudden onset. They have sudden onset. There is a gradual. If the symptoms are gradual, you want to consider depression, you want dementia, neurodegeneration diseases. Duration, you want to think of if this is day, hours. If they are hours to days, you want to consider delirium, intoxication, withdrawal. If they are weeks, if the duration have been weeks, you want to consider major depression disorder, acute psychosis, adjustment disorder. If they are having these symptoms months to years, you want to consider schizophrenia, personality disorder, chronic anxiety disorder. Phase 2 of the assessment will be evaluating the functional impairment. They have these symptoms, you know the time, and you want to know what functional impairment they have. Psychiatric disorders require evaluation of the work function, relationship function, self-care, social function. You want to assess that. And the fourth step will be you want to rule out the causes. You want to rule out the medical causes. First, you want to concentrate medical causes before you move on to psychiatric causes. Psychiatric diagnosis require consideration of the neurological illness, endocrine disease, infection, nutrition deficit that happens to people who are alcohol use or failure to drive, medication. If these symptoms are based on medication side effect or medication causes, if this symptom is caused by the substance usage, and then when you figure that out, you want to decide the medical disorders that mimic psychiatric illness, such as endocrine disorders, hypothalamus and thyroid diseases. Thyroid gland regulates metabolic through the thyroid stimulating hormone. So you want to assess that. You want to assess the thyroxine. You want to assess the thyroiodine, three iodine thyroidism. Thyroid dysfunction can strongly affect the mood and cognition. So you want to assess that. You want to also assess the hypothyroidism, how hypothyroidism affects the psychiatric, and what are the presentation of psychiatric symptoms. The hypothalamus hypothyroidism can mimic depression, low mood, fatigue. It has a low mood, fatigue, poor concentration, hyperinsomnia, psychomotor slowing, and the psychiatric differential diagnosis that you want to consider will be major depression disorder, persistent depression disorder, medication-induced disorder, depression. Then you want to evaluate the lab for thyroid stimulating hormone, free thyroxine, and you want to also assess if they are having an anxiety, panic, or mania. You want to assess the hyperthyroidism. Hyperthyroidism mimic anxiety, manic, and panic. The symptoms that they will have and present will be restless, insomnia, irritability, racing thoughts. New psychiatric presentation in adults should always include consideration of thyroid disease. If the patient symptoms mimic neurological disorders, you want to assess epilepsy, trauma, brain injury, and the symptoms you want to assess will be if they are having a hallucination, fear episode, personality changes. You want to assess seizure, and can present mood changes, psychosis, anxiety. If they are having a trauma, brain injury, symptoms they will present will be depression, irritability, impulsiveness, cognitive impairment. If they are having a stroke, you want to assess if they having a stroke, they will also have psychiatric manifestations such as depression, emotional liability, cognitive impairment. If they are having a tumor, brain tumor, possible symptoms will be personality changes, psychosis, headache, cognitive impairment. If they have any nutrition disorders, if they are depressed, and cognition impairment and psychosis, you want to assess and evaluate their vitamin B12 deficiency. You want to evaluate the complete blood count. If they are having a depression and cognitive symptoms, they may have folic deficiency. So folic deficiency is associated with depression and cognitive impairment. Mostly people who have alcohol withdrawal, they have these symptoms, and when you evaluate their lab, they will have folic deficit, they will have vitamin B12 deficit. So you want to evaluate and treat those deficits. If they have any infection, if they have any depression, cognitive impairment, or psychosis, they may have an infection, UTI. Elderly, when they have a UTI, they have that confusion and cognitive impairment. If they are having a human immunodeficiency infection, they will have psychiatric manifestations such as depression, cognitive impairment, psychosis. If they are having a neurophilics, that is low white blood count, they may have personality changes, psychosis, dementia-like symptoms. Psychiatric differential diagnosis of a depression include depression, major depression disorder. The features of major depression disorder include depressed mood, loss of interest, sleep changes, appetite changes, weight changes, fatigue, guilty, poor concentration, suicidal thoughts. Bipolar disorder or bipolar depressed, you want to assess the history. If they had a manic, that's how you can differentiate if this is depression, major depression diagnosis, or if they are having a bipolar depression. If they are having a bipolar disorder and this depression is caused by that, you want to assess if they had a history of manic, hypomania, increased energy, decreased need for sleep, grandiolous. If they have adjacent, if the depression symptoms such as that occur after identifying stress situation do not meet fully criteria of major depression disorder, you want to assess if this is just the adjustment disorder. If they had a alcohol, cannabis, stimulant, sedation, you want to assess substance-induced depression because they have the symptoms of depression, and you want to ask them if they have any, if they had or if they are withdrawal of any kind of substance such as alcohol, marijuana, stimulant, or sedative or hallucinogenic. Medication causes, you want to assess the medical cause of their depression. If they are having a depression symptoms, you want to assess if they have thyroid dysfunction, if they have anemia, if they have vitamin B deficiency, vitamin C deficiency, before prescribing any psychiatric medication, you want to always rule out for previous manic or hypomania because antidepressant medication can worsen the manic symptoms. Differential diagnosis of mania. What are the differential diagnosis of mania? Bipolar mania has a elevated mood, irritability, grandiolous, increased energy, decreased for sleep, need for sleep, risky behavior, pressure speech. Substance-induced mania, common substance that causes will be cocaine, steroid, amphetamines. Medical causes of mania will be hyperthyroidism, neurological disorders. So if the patient's symptoms mimic mania, before you assist them psychiatric, you want to assist the substance, you want to assist the medical, you want to assist the infection, you want to assist the nutrition deficit, delirium. If they have any psychosis, they may have any delirium. So you want to differentiate between delirium and psychosis. Delirium is acute onset, while a psychosis is gradual onset. Delirium is impaired attention, has impaired attention, while a psychosis is usually intact. Delirium will have common fluctuation, while psychosis is less common to fluctuation. And causes of a delirium include a medical and substance, while a psychosis is only psychiatric disorders. Differential diagnosis of a hallucination. What caused the hallucination? When you have the symptoms of hallucination, this hallucination may be caused by schizophrenia or bipolar or substance-induced psychosis. So if they are if they are having a auditory hallucination, delusion, disorganized status that is with the hallucination, then they have a schizophrenia. However, if they are having a severe manic with the hallucination, then they have a bipolar and with the depression. If there is a depression, if there is a mania, that shows you they have a bipolar disorder with the hallucination. Severe mania with the hallucination, severe depression can also cause the hallucination. However, if they are having a substance-induced psychosis and they are hallucinating, you want to rule out, you want to assess if they had a cannabis, if they had a cocaine, if they had amphetamines. You want to also delirium. If they you want to also rule out if they have any delirium, if they have any visual hallucination or alter level of conscious. You want to check if they are having a delirium. Delirium is a medical emergency. So you want to rule out substance and medical differential diagnosis. Substance-induced psychiatric disorders include the alcohol, Always ask when did the substance begin relative to the substance usage. Alcohol intoxication, disinhibition, mood changes. Alcohol withdrawal can cause anxiety, tremors, seizure, delirium. Cannabis possible effects include anxiety, panic, and psychosis. Stimulants such as cocaine or amphetamine can cause manic symptoms, paranoia, psychosis. Medical-induced psychosis, medical-induced psychiatric symptoms include corticoids. Corticoid medications can cause mania, depression, and psychosis. Dopaminic medications can cause hallucination and delusion. Anticholinergic medication can cause confusion and delirium. You want to assess, also you want to identify the present syndrome. You want to assess the safety. You want to obtain a complete psychiatric history. You want to perform the psychiatric assessment. You want to review the medication and substance usage. And then you want to order appropriate lab evaluation to rule out. You want to establish using the DSM-5 diagnosis criteria. You want to also create a treatment plan after you rule out all that and after you after you go through that steps, which is the first step of psychiatric diagnosis assessment is to identify the presence of the symptoms. You start with the symptom and then you will assess the safety. Is this symptom can these symptoms cause risk to the patient or to the others? You want to assess that risky factors. And then the step 2 is to assess step 3, you want to assess the psychiatric history. If they had a similar symptoms, and then you want to assess, you want to perform a psychiatric assessment, and then review the medical, if there is a medical condition that causes these symptoms or substance that they are using cause the symptoms. So you start the symptoms and you go through the steps and then you perform the psychiatric assessment and review the history and then review the medication and medical condition that they have if they had the symptoms like this one, and then you want to order lab to evaluate, and then you want to establish the diagnosis using the DSM-5 treatment diagnosis, and then you want to create a treatment plan. For common laboratory evaluation in psychiatric assessment include it depends on the presentations of the symptoms, and then basic testing include the complete bowel count, comprehensive metabolic panel, thyroid function test, urine for intoxication, pregnancy to rule out. Medication-specific monitoring include the lithium, that you want to also check the lithium level and concentration, kidney function, thyroid function for lithium, patient who is taking lithium. Patient who is taking folate, you want to monitor the liver function, platelet count. If they are on antipsychiatric medication, you want to monitor their weight, their body mass index. You want to assess the glucose, lipid profile. So certain psychiatric changes in orderly is medically until otherwise proved. Psychiatric with fluctuation attention suggested delirium. If the attention and level of conscious is fluctuating, that is delirium. Depression with decreased need for sleep and increased energy is a bipolar disorder. Always review the medication before diagnosing a psychiatric disorder. The best diagnosis explanation is the symptoms, the time of the course, function impairment, how this symptoms affected the person function. You want to exclude of alternation. Thank you for joining me today. Please subscribe and join me again.